Hello, good evening. My name is Dr. Chudi Ufondu, and today we'll talk about hypertension. Hypertension. Hypertension is a disease condition that it's considered a silent killer. So generally, hypertension is considered a silent killer. So we're going to look at what hypertension is all about. We're going to try and understand what leads to hypertension. Then over time, we're going to look at various options of what you need to do in regards to controlling hypertension. So hypertension is pretty much a condition where the forces of your blood pushing against the wall of your blood vessel, it's consistently high. So let's pause for a moment and think about this simple definition. So in everybody's body system, you have your blood, you have what we call the circulatory system. So your circulatory system is actually comprised of your heart. So your heart is the central place where the blood is made. So I'm just going to use kind of simple layman terminology because if we go into details, the actual place the blood is made, it's different from where the blood is pumped. So I'm not going to confuse you. Let's just assume that everything happens in the heart. So your heart pumps blood to various parts of the body. And we all need blood to function because blood transfers oxygen to all the tissues and all the systems in the body. Without oxygen, you cannot function properly. So, in high blood pressure, for some reasons, the pressure, the force inside the blood, which pushes against the arteries. So there are things we call blood vessels. So these are conduits that help the heart to distribute blood to the various parts of the body and also helps the heart to return, blood to the heart. So that's pretty much what circulatory system is all about. But specifically in high blood pressure, your artery, it's what's actually in danger. So the force inside that artery is a lot. It pushes back. So why is your blood pressure very important? Your blood pressure is very important. Like I explained, you need your blood pressure to function properly because you need your oxygen in various parts of your body to function properly. So if you don't have oxygen, you won't function properly. So that's actually the reason why your blood pressure is very important. So various parts of the body that needs oxygen to function properly will definitely get adequate supply of oxygenated blood. So there are two types of blood. You can have oxygenated blood and deoxygenated blood. Oxygenated blood is simply blood that contains oxygen. Deoxygenated blood is simply blood that oxygen that was contained previously has already been distributed to other parts of the body that need the oxygen. So it's important that your body maintains a normal pressure of both distributing the blood that contains oxygen to various parts of your body where you need them, and also returning the blood that has already been stripped of those oxygen to go back on again. So it's a kind of a loop. So when this particular pressure exceeds the normal given range, so generally high blood pressure is described as having consistent reading of 140 over 90. So normally if you talk about blood reading, we're looking at two numbers. The upper number is what we call the systolic. The lower number is what we call the diastolic. These numbers are very important. So when you have consistently higher number above 140, 90 consistently. So it's important you follow my explanation. High blood pressure doesn't mean you went to check your blood pressure one time and you had 140 over 90. You're not considered hypertensive. You are considered hypertensive when you have it consistently. And it's always important to check it at exact time of the day. So if you checked it in the morning, it's important you check it in the morning consistently, subsequently. So let's say weekly for the next 4 weeks, if you keep having 150, 100, or above 140, 90 for 3, 4 consecutive weeks, then you are considered hypertensive. There are different classes of hypertension. You can have mild hypertension, you can have moderate hypertension, and you can have severe hypertension. But once you are in the category of hypertension, it's important you know exactly what to do. Hypertension can be familial. So what do I mean by being familial? It can be in a particular family lineage. So if your parents had hypertension, likelihood you might develop hypertension is there. So if your daddy had hypertension, if your daddy is currently a hypertensive client, likely you might have predisposition to developing hypertension. So you have a risk factor if your daddy or your mom or your siblings have hypertension. So it's commonly seen in those families. Anybody can develop hypertension. And there are actually two types of hypertension. You have what we call primary hypertension or essential hypertension, and you have secondary hypertension. So primary hypertension means it starts from baseline. So generally, no one knows the exact thing that leads to hypertension, but what we know is the risk factors. Secondary hypertension happens when the circulatory system, like I mentioned, or you have problems in some parts of your body. You have some problems in your system. Maybe you have a kidney problem, you have a heart problem, you have a liver problem. Those systemic diseases can come with changes in your blood pressure. So that's called systemic hypertension, secondary hypertension, as against primary hypertension or essential hypertension. So it's important you know all this. And when you know all this and you know how to go about it, then you can begin to take basic steps. Now, there are a couple of things you need to do that might not really warrant you to take medications. Very simple, basic things you have to do. One of the first things you have to do is to be aware. Awareness is key. In this era of spirituality, in this era of denial, so many people don't even believe in the concept of hypertension. When they check their blood pressure and they see that it's high, they pray it away, they bind and cast. There is absolutely nothing wrong in praying, but we have to separate our reality from our religiosity. When you go to the hospital and you're told you have blood pressure, it's important you follow through. So while you're praying against it, it's also important you do the right thing. It's not okay to bind and cast and leave it on the spiritual realm alone. It's important you take the medical route. There's a reason why God gave doctors that ability to help to make people better. So while you're praying, also make sure you do the right thing. Now, I'm going to quickly share one or few tips of things you can do basically that will not warrant you taking any medication. The first on the list is what you eat. When you eat controlled diet, when you're mindful of what you eat, of which you have to eat more of fruits, vegetables, and more whole grains, and you watch your calorie, and you also watch foods that contain high cholesterol, and also mind generally the calorie content of what you eat. When you eat around very healthy food, you are giving yourself a better chance. Second thing, you have to exercise. Exercise is huge when it comes to control of hypertension. So whether you are having predisposition to developing hypertension or you are already a hypertensive client, when you exercise, you increase your chance of controlling hypertension or even avoiding it. You have to stop smoking 100% completely. You have to reduce your intake of alcohol. Alcohol moderately taken can, to an extent, help in one of few things. So alcohol is not 100% deadly, depending on the quantity you're taking. So generally, it's still controversial, but some school of thought believe that when you take alcohol moderately and, within a very tight guided protocol, you can actually have some health benefits. Avoid heavy intake of caffeine. Reduce it. Some people can have increase in their blood pressure when they take caffeine. Also avoid intake of sodium. Sodium is mostly seen in your table salt and other, preserved products, like if you eat packaged foods and other stuff, they contain high sodium. You can also try and increase your potassium. So potassium is anti-sodium. So when your potassium level is high, your sodium level goes down. So there are a couple of food items that have high content of potassium. Then you have to avoid stress. When I mean avoiding stress, so long as you're a human being, you can live without stress. Life itself is stressful, but there are chronic stresses that can predispose you to having problems with hypertension and other problems generally that can affect your general health. Because the problem with hypertension is the fact that when you develop hypertension, the possibility you will have other chronic condition is very high. So most people that develop hypertension might end up being obese. So most people that develop hypertension might end up being diabetic. So they all work hand in hand. Matter of fact, there's a concept we call syndrome X. So if you develop hypertension and you have diabetes and you have obesity, the combo of the three is called syndrome X. Very, very deadly. So the key word here is to take charge of what you do on a daily basis. So when you exercise, when you eat good food, when you avoid high sodium intake, when you don't smoke, when you reduce your alcohol intake, when you watch your stress level, when you sleep, sleep is a huge, huge, huge component of what I'm telling you. So these are the things you can do on your own that will give you a better chance of having a very good chance of controlling hypertension if you already have it, or preventing hypertension if you don't have it. So you can have family history of hypertension, but if you change your daily lifestyle, you can actually shortchange development of hypertension by your daily lifestyle. And for some people that have hypertension, if you change your lifestyle and you're consistent, you can stay off taking medications. But please let that decision not be what you alone can take. It's important you work with your provider to know what's best for you. Another thing you can also do in regards to controlling hypertension is to keep your eye on the reading. So try and have a home kit for checking your blood pressure. There are a couple of automated blood pressure blood pressure machines you can get at home. You can check and track, especially if you are hovering around 130/80. You are considered pre-hypertensive. So you can get it at home. You can use it to keep yourself accountable. It doesn't mean you have to be checking it every day. Okay, then overall, you need support. So if you think you're not making right decisions, you need care. You need people that care about you, that will remind you on the basic things you need to do on a daily basis. So these are a few things you can actually indulge in that will help you to overcome the scare of hypertension. Now, the reason why you need to take this serious is because hypertension is a silent killer. Why is it a silent killer? It doesn't have specific symptoms. Some people will just be living a normal life without any symptoms that they have hypertension. Meanwhile, they've already developed high blood pressure without knowing. So some people, they can come with complications already, but if you don't know you have it, and you don't go for your regular check, you might have developed it over time. And if you don't take time to control it, it can cause a lot of damages. It can affect your vision. It can lead to stroke. It can lead to systemic failure. It can lead to heart failure. It can lead to so many things in your body. So it's important you follow this very important broadcast and change your life. When you do this on consistent basis, you will have a better chance. The reason why I'm laying emphasis on the spirituality is the fact that so many people are living in denial. So many people got prescribed antihypertensive, but they are not taking it. They are challenging, the whole status quo. That are just believing in the spiritual aspect. There is absolutely nothing wrong in doing that. But guess what? You have to take your medication. And so many people have died from poorly diagnosed hypertension or misdiagnosed hypertension or entirely different switch. So when they tell you you have hypertension, instead of going the normal conventional way, you want to go take herbs, you want to go the shortcut, which we normally do. You don't have to do that again. So knowledge, it's what you need. Ignorance is no longer admissible. This is modern era, so you need to know. Okay, so thank you for coming, and I hope you will benefit from this video, and I hope to be back next time. Until then, God bless you, and bye-bye for now. God bless.